This is my biomechanics presentation and it's on dysfunction of the equine sacroiliac joint. So how does sacroiliac joint dysfunction affect equine biomechanics? Firstly, it's important to understand biomechanics, which is the science of movement. This can be analysed through gait analysis. A gait is a repetitive manner of walking or running, and it's considered as discrete patterns of footfalls that are divided into symmetrical and asymmetrical gaits. Gait analysis interprets kinematics, which is the movement patterns, and kinetics, which is the forces that are involved in those movement patterns. Lameness, therefore, is an abnormal stance or gait which is caused by a structural or functional disorder of the locomotor system. It could be caused by trauma, acquired disorders, infection, metabolic disorders, or nervous or circulatory system diseases. The equine sacroiliac joint is located between the wing of the ilium and the wing of the sacrum. It's approximately oval in shape and the long axis is angled to the midline. Upon identification by scintigraphy, the sacroiliac joint appears wider and more laterally positioned in an oblique view in contrast to a dorsal view. The location of the joint has been proven angulous in most horse breeds. The closely fitted joint surfaces are flattened and angled at a measurement of 30 degrees with the horizontal plane. The shape of the joint fluctuates between L-shaped and C-shaped, and the contour of the joint can be flat or convex. It is described as an atypical synovial joint due to the iliac surface covered in fibrocartilage and the sacral articular surface in hyaline cartilage. The joint is held in place by a tight ligamentous structure. Sacroiliac joint dysfunction is a relatively poorly understood condition in the horse, and changes to the joint are difficult to diagnose. This is due to the mild chronic clinical signs and the location of the joint. In the past, it was called the dustbin diagnosis, as diagnosis was only given when there was no other explanation for the cause of the symptoms. Recent research has found a high incidence of pathological problems in the sacroiliac joint during equine postmortems. This has enabled advances to establish correct and a more thorough diagnosis. Sacroiliac joint dysfunction is common in athletic horses, often older horses and in larger breeds. It's mostly affected warm blood types. It's not been proven that this is due to the conformation of the warm blood horse, and it's more likely referred to the discipline. Pathological changes in the sacroiliac joint include lipping, cortical bush dressing, and osteophyte formation, which together with enlargement of the joint surfaces. Ligament damage is also commonly seen. The pain is perceived as a deep aching pain, but this is based on reports similar to pathological conditions in human beings. In this plate, you can see two horses that both have sacroiliac joint dysfunction. You can note the prominence of the tuber sacral and see the atrophy in the middle gluteal muscles. Overall, poor in hindland musculature. Dyson and Murray noted that poor development of the apaxal muscles in the thoracobular region was one common symptom of horses with sacroiliac joint dysfunction. The most commonly reported sign of sacroiliac joint diseases in horses is poor performance and poor hind limb action, lack of impulsion, failure to engage the hind limbs, and a mild chronic hind limb lameness. Barstow and Dyson found horses generally change behind during canter and a stiff, stilted canter. Poor hind limb impulsion and poor flexibility of the trunk are also common signs. Changes in behaviour, difficulty working on the bit, and difficulty with lateral work and refusing jumps are also commonly seen. Garcia Lopez stated in his research horses moved with the thoracobular region in extension and a high head courage. They also had problems during canter and showed bunny hopping, incorrect leads, and reluctance to canter. The research also spoke about, as mentioned earlier, poor development of the thoracobular, apaxal, and pelvic muscles. This is a snippet taken from a research article which just states some of the commonly seen symptoms in horses with sacroiliac joint dysfunction, but I've gone over quite a few of them already. So, clinical signs on the hand and on the lunge. Plaiting of the hind limbs has been noted alongside. It has been noted in trot alongside scuffing and dragging of the hind toes. Moving closely behind is commonly seen, but moving widely behind is also seen in horses. A plaiting-like gait behind is very common and positive in hind limb flexion tests. Some horses are unable to perform hind limb flexion tests at all due to chronic pain. During lunging, horses are more likely to change their gait behind and become disunited. but this could just be that because when the horse is ridden, the rider is able to hold the horse together, which may prevent the horse from disunited. Signs can also be apparent on the lunge, as gait irregularities on a tight circles are sometimes more obvious. There's some pictures of some horses cantering, and you can see in them that they all look pretty unhappy. Sorry. In B, you can see the horses bucking. In the first picture, you can see the horse with the ear back and just negative facial expressions. So the most prominent signs are seen in canter, but why is this? Clinical signs may be more prevalent at canter because of the 3B asymmetrical gait, which results in one hind limb weight bearing alone for a portion of the stride cycle. Only one hoof in contact with the ground during the stride cycle, which may increase pain compared with walk and trot, which are both symmetrical gaits. Canter is an asymmetrical gait. There is also maximal flexion and extension motion in the lumbosacral region in canter compared with walk and trot, which may aggravate pain. There's also a rocking motion during canter and a demand for more hind limb impulsion, which puts excessive strain on the sacroiliac joint. These, again, there's 3 pictures. You can see the horses being ridden. In B, you can see them coming above the bit. C, you can see like just unwillingness behaviour, napping. And again, they've all got negative facial expressions. So in accordance with previous observations, clinical signs are worse when ridden compared with in hand or on the lunge. The addition of the weight to the saddle and the rider are likely to influence the way that the horse moves, especially when a horse's back is overloaded. It makes it difficult for the horse to ride in balance. Thoracombal sacral extension increases and flexion decreases when the thoracic region is loaded. An overall range of motion in the thoracombal spine is less with a rider compared with just a saddle alone, or no saddle or rider at all. Evidence has proven that an increase in lumbosacral joint motion when loaded in comparison with an unloaded spine, and such changes may influence the biomechanical function of the sacroiliac joint and alter the stress on the supporting ligaments, muscles, and fascia, initiating pain. In addition to this, in addition to the loading of the rider, it also affects the head placement, which has further impacts on spinal motion and alignment of the joints. The tendency to come above the bit, which is observed frequently, is likely to reduce back motion because thoracombal sacral movement is highly influenced by head and neck position. This creates a potential vicious circle. It's important to differentiate these horses from those with bilateral hind limb lameness, thoracombal pain, and lower grain lamenesses. If they're performing badly because of these problems or because of the rider. So what can we do? Treatment is often symptomatic, and in people, anti-inflammatories and injection of corticosteroids and proliferate are advocated as sole treatments for the sacroiliac joint dysfunction. But proliferately and injection of anti-inflammatories are ineffective due to the deep location of the joint in horses. Acute sacroiliac joint injuries can be cured with anti-inflammatory drugs and box rest. This is just acute, not chronic. This can be done over a period of 4 to 6 weeks with strict box rest, hand walking afterwards, and NSAIDs may be given during this time. Rogers stated that the use of acupuncture may be of use for myofascial pain that surrounds the sacroiliac joint, but the most effective result is actually in a specialised physiotherapy program that is aimed to strengthen the joint, build up surrounding musculature, and that would normally be based on palpitation and mechanical findings of the physiotherapist. And there are my references. Thank you.